Coming up today, this man was barely able to leave his living room due to liver disease. His painful wait on the transplant list, plus the new life brought by a new organ. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. The man we are about to meet today admits he was starting to lose hope while he waited for a liver transplant. Fluid kept filling up his abdomen. He could barely leave his recliner. Eventually, toxins started building up in his brain. But today, he is living what he calls his new life, thanks to a donor and a care team who made it their mission to get him a new organ. That man is Terry McIntyre, who we are so happy to be speaking with today. How are you?
I'm very good. Thank you.
Well,
Thank you. Blessed.
So, you are blessed, and we are so blessed to have you here with us today. We're also so glad to have back with us Dr. Ryan Taylor, transplant hepatologist here at the health system.
Good morning.
Glad to have you back.
Thank you.
We're talking a lot about the liver these
days. I love
days.
it.
I know you do. I know you do. It's your favorite organ,
It
but
is.
we're learning a lot about the liver and transplantation. And we're excited to hear about Terry's story. Terry, liver problems can start silently, as we're learning. It was about 7 years ago when blood work showed that your liver enzymes were elevated and you were sent to a hepatologist. Do you remember feeling ill at all?
No. In fact, I was doing an annual checkup, and in the annual checkup, when they did the blood work, it came back with liver enzymes being elevated, and I wasn't feeling sick at all. And it was, of course, then they said, well, because the enzymes are elevated, we need to get you in and get a biopsy. And so went in for the biopsy, and they confirmed cirrhosis. And of course, you don't have an idea of to how big an extent, but you know for sure there's cirrhosis. And so that's when the whole kind of like life began to change a little bit.
Well, first of all, good that you were getting your annual checkups.
Yes.
I liked that
Yes.
story. But you were asked to see, you were told to see a hepatologist, and then you were told to see Dr. Taylor, and you wanted to see him specifically. Tell us why.
Well, my father also had to have a liver transplant, and Dr. Taylor was in charge of that. And the family was extremely pleased with the situation and how things went and what went on. And actually, he's very easy to talk to and relate with, which that's extremely important to somebody. It was to me anyway. And what happened was I went to see him. They did the biopsy, and they found the cirrhosis, and we began talking about what should happen in the future, and I also got a few teachings about what to watch for, which that's extremely important because you don't have a clue what to watch for, and you don't know where this type of situation will show up. And it's not like it's, at this point, when you're as far along as I was, it's not reversible. It's not like it's going to all of a sudden flip over. Now, you might be able to pause it somewhere for a little while or whatever, but traditionally, I guess, it gets worse and worse.
Dr. Taylor, hard to believe that look at your face. Look at this face. Hard to believe that you're treating multiple generations. What do you remember about treating Terry's dad?
Jack.
You know, it was very amazing. He actually has the honor of probably being the longest survivor of a liver transplant that I have the honor to take care of. So it was, amazing to take care of him. He was very robust throughout his life, and then to meet his son is just puts it in perspective.
I thought it was an honor, though, to
it was
be able
a complete honor
to care for his son. Is Terry's path to you, though, pretty typical? Someone has little to no symptoms, as he mentioned, but there's something on the blood work that then gets sent to you, and then here we go.
Absolutely. That's how most of our patients find out they have a problem. They get a physical or an insurance checkup, and all of a sudden one of their blood tests flags, and then they're sent to us, and we do our investigations. And unfortunately, people can walk around and have cirrhosis and not know it.
Gosh, and Terry did a good job of starting to explain that. You performed this biopsy. led to this diagnosis. So what was going on, kind of more medically speaking, with Terry's liver, with the cirrhosis?
So early on, he just had some mild liver test elevations, and we did the biopsy and saw a little bit of fatty changes to the liver, and we knew that that was the likely cause of the damage. And then we just worked and watched him very closely. He's an excellent patient, always on top of everything, and was getting his routine checkups. And then bit by bit, he started to have more and more symptoms, and eventually kind of became a textbook case of all the things that can happen with cirrhosis.
Because you're a pretty healthy guy, quite an athlete through the years. Tell us a little bit, a quick, brief history of your.
I held national titles in springboard diving, trampoline, judo, karate, gymnastics. Extremely active, not only in physical things, but also spiritually. Licensed minister, preached revivals, pastored, all of these type of things. Very active. I was a hyperactive kid, so grew up to be a hyperactive adult.
Quite a list, Terry, I have to say.
But fun. Yeah. A very fun list. And I love to garden. I love to do remodeling in houses and things. And as the situation got worse, of course, all of that kind of fell off to the side. But when it all started, I had no clue. And that's when, at one point, I came into the house after gardening, and I began to feel sick, really quick. And my wife is a nurse, and I said, I think I'm going to regurgitate. And so she had a big salad bowl. We were working on making a salad, and it was empty. And she handed me the bowl, and I almost filled it with blood. I just literally. The indigestion and stuff I was having was from the blood filling up inside of me. And I just literally, like in one or two, it just filled. And she said, we've got to get you to the hospital. And she loaded me up, and there's a hospital close to our house. And she took me there, and I had varices in my throat that had exploded.
Well, Terry's explaining this event that's happened, this fluid, which was blood, that's building up, and he has this busy lifestyle, which goes to show that it's going unnoticed.
Yes.
He's not noticing this. What is causing this cirrhosis? I mean, what is causing all of this to be happening?
So usually someone starts with the disease process, such as fatty liver or hepatitis that cause scarring of the liver. And then as the liver scars down, you start to get increase in pressure in the circulation of the liver, and that's called portal hypertension. And that's what then can start causing a lot of these complications Terry's experienced.
So there was an effort to change the name of liver disease. Could you explain the preferred name and why there was a need to change it from the old name?
Yeah, so fatty liver is what the layman's terminology is for right now the most common liver disease that we see. And medically it was called NAFLD, and that stood for non-alcoholic fatty liver disease. But that terminology, non-alcoholic fatty liver disease, isn't a great term. And so it was recognized that it wasn't appropriate for all patients, and so we have now adopted new terminology called MASLD, which stands for metabolic dysfunction associated steatotic liver disease. Quite the mouthful, not good for a news show, but it reflects medically more appropriately what's going on in the patient.
So what causes MASLD? Can it be prevented?
So it's associated with metabolic disease, and so those are things such as diabetes, having an elevated weight, having high cholesterol, high blood pressure, those kind of things, and stems from how our body uses energy.
So Terry, of course, eventually needed a transplant, a liver transplant. But how is MASLD treated before a transplant is eventually needed?
So first and foremost, recognition and diagnosis is the most important thing, since it is very silent for most patients and have no symptoms, so we have to catch it early. And when we treat patients, then we focus first on diet and lifestyle changes, and thankfully now we're seeing more and more medications come out that can be an offer to help patients.
So a few months after meeting you, Terry was getting routine EGD. We have some video of this with a scope checking out his esophagus and stomach, and they found something called varices, kind of like a varicose vein inside the esophagus. So Doc, can you help connect the dots between the liver and the veins inside the esophagus? What is that telling you?
Yes, so when patients get cirrhosis, the special circulation of the liver starts to back up, and as it backs up, it can start forming veins in places that don't belong, and as those veins get bigger, then they have a risk of rupturing and bleeding.
So how are they treated?
So we treat them through the scope, endoscopy. So we put a scope down the mouth and then into the swallowing tube, and we have a neat little banding device at the end of the scope that will suck up the tissue. We turn a knob and it deploys a rubber band, just like a very, very tiny rubber band that's very tight, and will pinch off that vein and then cut off the circulation, which will lead to scarring and hopefully prevent further bleeding.
So Terry, I understand this is when some of your worst symptoms started. Is that correct?
Yeah. At first, I should say when I first went in with the bleed out and everything, that they had me for 6 days, and periodically went back in and were banding other things, and but then after that, it got to where it was like, once every month, then once every 2 or 3 months, and then eventually it got to where, and this is going to sound odd, but as you get banded, there forms scar tissue. And the scar tissue, while it sounds bad, is actually profitable, as I understand, because it helps to make it stronger so things can't happen as easily or as readily. And so it eventually gets down in numbers. But we're talking like 19 times having to be banded.
And on top of the bleeding in the esophagus, Terry, your abdomen started filling up with fluid. Were you able to see? And I think you were able to see that. You were kind of explaining the turkey. Tell us about your belly button. And
Yeah.
You were kind of like the turkey's done.
Well, on a normal occasion, I have an any belly button. And as I began to take on fluid, which, by the way, at first happens very gradual. You don't even really know it. And you just think you're getting fat for some reason, and you don't understand why is your belly getting fat. You know, the rest of your body's not showing fat, but your stomach's getting bigger and bigger. And in my case, it happened gradual enough that I didn't notice horrible discomforts at first. And but what would happen is my abdomen would fill up. And as it did, my stomach would go out, and as it had enough pressure, it would push my belly button out. So I was like a turkey, you know, at Thanksgiving. Had that little red button that's in it, and when it's done, it pops up. Okay, well, when I was done, my belly button popped out.
It's time to drain you out.
Yeah, it's time to go get drained.
And you would have to bring different size of clothes, like your small, medium, and large sizes,
yes,
right?
I had 3 totally separate wardrobes. At the highest point, just before, not too long before the surgery for liver transplant, I was at about 10 liters of liquid in my abdomen. And at first they were just taking out like 4, 5, whatever. But toward the end, every week they were taking out up to 8, 9, 10 liters of water. That's like 4 big soda pop bottles, liters, out of me.
Where was this coming from, Dr. Taylor? Where's this fluid coming from? It has to come from somewhere.
Yes, it's the same concept from that pressure building up, and then it eventually is just forcing some of the fluid out of the vascular system, and it just starts to accumulate inside the abdominal pocket.
And is this story typical? I mean, we're going to be talking with you over the next several months about liver transplants and liver health. Is this the story we're going to continue to hear, or what stands out in particular about Terry's story?
You know, really, this is, as I said a little bit earlier, he's kind of a textbook case of liver disease. He had all the common things that people see with advanced liver disease. He was a trooper through it. He's a really tough guy. Obviously, he jokingly says he has all these things, but that's a lot to go through.
That is a lot to go through.
It's a lot to go through, because some people will get their belly drained. I think at one point he was getting tapped once a week to pull this fluid off, and then you come in once every month or every couple months and get a scope. He's getting multiple blood draws. It just really takes over your life with your symptoms.
It does. You had the stamina, Mr. Black Belt. You had it.
Well, I always have been blessed with a great, healthy body. And when stuff started crapping out, that's quite a whole lifestyle change.
It is.
Could no longer do almost any of the things that I loved doing. Thank goodness I had a wonderful wife through it all.
That was my next question,
Oh.
because it must have been tough on you, but you had quite the support system in the way of this woman right here.
Excellent. That's Elise. Hi, Elise. Hi. She is a nurse who also has a legal background, and she's quality control over children. And she is 2 things that she did that were absolutely off the charts wonderful. One is she could take and understand the language that doctors and pharmacists speak, because that's one of the big things that can bring comfort to you. is to actually understand what in the world they're all talking about, because a lot of professionals use language that they all understand, but I would have not understood. And she made them make sense to me, which that's very comforting. Also, being a nurse, she didn't freak out over anything. And a lot of the stuff would have freaked out people. But she's calm, level-headed, you know, like she always said, I can always wait till later and freak out. I don't have to freak out now, you know.
Well, and you're going to tell a story here in just a second as to where that came in handy, because Dr. Taylor, transplantation then became an option. When did that happen?
As soon as we started to see him decline, I remember one morning in particular, he was in for his scope, and I was really just taken aback about how much weight he was starting to lose in his face and getting weaker, because I knew he was such a robust person. And we started to see his lab work go up, and so that was clues that we needed to get him on the list.
And then about a month later, your wife needs to call 911, I understand, Terry?
Yes, I had about 2 days of total incoherence. I had no idea where I was, what I was doing, what was going on. Apparently, I had wandered into the front room in the middle of the night, like 1 o'clock, and had sat down in almost a recliner type of thing, and she woke up and realized I was no longer in bed, so she gets up and she hunts around for me, comes in the front room and finds me kind of like sitting there, and I am growling like an animal and flailing. And she tries to comfort me, talking to me, things like that. Doesn't get close to me, because if I hit her, I might break something, you know, because of my karate. And so she has enough smarts to not get in too close, but she can't talk to me. I can't understand. I can't get a hold of what's going on at all.
And Dr. Taylor, there's something actually happening here. This is a medical term.
There is. So he was having manifestations of hepatic encephalopathy. And so this is the third thing that can happen with patients with cirrhosis. And so this is where the sick liver doesn't detoxify the blood. So these toxins build up in the brain and can make people have personality change, behavior change, and almost develop like an Alzheimer's-like picture sometimes with their memory and just being in a fog all the time.
Wow. So after that scare, Terry's still getting fluid drained from the abdomen. And then
Yep.
when does this transplant take place? How soon are we able to get the transplantation?
Well, it's all the organs are shared based on your MELD score, which is a blood test blood calculation that we do. And so Terry's was starting to creep up, but it wasn't quite getting to where it needed. And then we got a lucky break and thankfully got the gift that he needed.
Explain the MELD score. We always have to do that for people.
Yeah, so the MELD score is a calculation that we do that takes 5 common blood tests, and you put it into a calculator and spits out one number. And then this number correlates with how sick your liver is, and we use it to rank order patients on the transplant list.
And where was his at the time?
He was in the low 20s.
Okay, so
high enough that we knew he was sick, but to really be competitive, certainly nowadays you have to be in the low 30s to really be competitive.
And how were you doing mentally at this time? Just how were you able to hold out hope? Because you had mentioned this was such a lifestyle change. You were such a healthy guy.
I'm very blessed in that I'm a believer in Christ, and I have a tremendous church family and a background in trusting Jesus. And while emotionally it was a roller coaster, tremendously roller coaster, spiritually I was okay, because I had at certain points well, let me say this first. The number of people who are able to get transplants is not equal to the number of people that need transplants. Nowhere near. And people have to get pretty bad off before they're able to get a transplant. Now, people might think that that's totally up to the doctor. It's not totally up to the doctor. I guess there's a government thing or something that has to do with who can and who can't get. And they take a lot of things and weigh them together to decide. And the odds of me getting a transplant were really bad. Really bad. Because, one, I was too healthy. Kind of odd to hear that, but it's kind of true. I was kind of too healthy to get a liver transplant, even though I was so sick that I needed a liver transplant. Even the fact that I had to be rushed to an ER with not knowing who I was, where I was, or what was going on, that in itself still wasn't enough to do anything. It has to be like a total of everything together to get you to that point. And because I sure thought after I got out of the hospital with that, which that was quite a situation. After I got out of the hospital with that, I thought, well, I ought to be like ready to get a liver transplant. Well, that wasn't the case.
Well, that's what Dr. Taylor always says, is that you're always watching that MELD score.
Yes.
It's a tricky little number that you're constantly watching,
Yes,
right? And
absolutely.
it's always watching, and you got to hover right in the sweet spot.
Yes.
To get that transplant. And we want to hear more about the transplant here in just a moment. Just a quick reminder to our audience that you can ask questions using the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Terry, in May of 2024, 4 a.m., middle of the night, you get that call. What did they say?
Well, let me first of all say that I had already become comfortable with the fact that I might not get one. The MELD score of 20 was kind of an old MELD score, and as I reviewed the histories of who were getting liver transplants, it was up getting closer to 30, and I wasn't anywhere near there yet. Well, I was near there, but not, And so I kind of had got comfortable with the fact that I probably would pass away before I would get a liver. And that's a wake-up call. And so at like 4 o'clock in the morning, we're laying there in bed. And of course, now when you go through this process, you learn that you have to have your phone with you all the time. Because in hope that someday you might get a liver transplant or whatever, you have 2 hours to get there. So I was laying in bed, and I get this phone call, and my wife's there, and I say, yeah, and they're like, Mr. McIntyre, would you still be interested in having a liver? And I'm like, no, let me think about it. Yes, I would love to have a liver. They said, we think we have the perfect liver for you. And I was like, oh, give me just a second, okay? And I said, honey, you got to hear this. You got to help me to know I'm not dreaming, And so I put her on speaker, and she said, yes, we have what we think is probably the perfect liver for you. Could you be here in 2 hours? And I said, because they'd already told you, if you can't get there in a certain length of time, you can't come. Because
okay,
I have
how far are you from the hospital at this time?
Platte City.
Okay.
So 45 minutes if nothing goes wrong.
Okay.
I'm
loving this story, by the way. I'm like on the edge of my seat. Okay, go ahead.
So, surprisingly enough, we got cleaned up and got our clothes on and went there and got there, and you check in, and they of course do a little bit of paperwork and stuff. They don't overload you, and then they moved me into a prep area. And that's all reassuring to you, because you're feeling like this is going to happen. And then they come in and tell me, well, the doctor hasn't got to review the liver yet, and he has to review the liver, so this may not work, it may not happen, which, you're sitting there going, that's not good. And they said, but we think it's going to, and so we're going to begin hooking you up to everything and getting you ready in the hopes that this is all going to go. And they said, and if it doesn't, this will be a good practice session for you.
A practice run? Okay.
And so pretty much I, at that point, had 4 or 5 doctors at my bedside with nurses running everywhere and paraprofessionals. And so I literally felt like I was at the bottom of a football dog pile. And everybody had some limb or arm or whatever of my body doing things with them. And my wife, because she's a nurse, at one point they were going to do an arterial line. And the doctor who was doing it, I think he may have been an anesthesiologist, I don't know. But anyway, he says, now this is kind of like an IV. Well, let me tell you, it is not like an IV. The only thing that resembles an IV is that there's a needle involved. And it is substantially more uncomfortable. And my wife actually had to leave because I cried. And so they put the line in, and then she comes back immediately. And but everybody's getting me prepped. And the doctor came out and saw me, and he said, we think things are going well and stuff. And he said, but I still haven't gotten all the review of the liver thing, because they run tests and stuff. And he didn't come back, and the next time I saw him was after the surgery. But he was there for the surgery, but I didn't see him during the surgery. And they came back out and they said, it's a go, which that's very comforting to you. You're laying there and you've spent by this time, you spent quite a bit of time getting all hooked up, wired up.
And when do you know that this is happening, by the way?
They keep us informed, and then we just keep constant updates, and we get updates on the donor.
Did you get the early call too?
I got a notification that there was going to be an opportunity for today. I was probably sleeping at the time because the surgeons are working. But I did get the notification as soon as we got an offer, which was just so amazing.
So you get to rest, kind of going, okay,
yes.
my guy's being taken
yes,
care of.
Absolutely.
And then you get to come in and go bedside and be like, how's it going?
Yep.
And then you get to go see him.
Yeah, I went up and saw him, and I was just so happy knowing how much he suffered and how much he went through. And this is the most rewarding part of our job, is to get to see these successes happen. And so it's just truly a blessing.
And then how long were you in the hospital? Because I think we have some photos of you like eating your hospital food, loving life.
It wasn't that long. 5 days?
Yeah, I think it was 5 or 6 days. You were pretty quick.
5 or 6 days. I had drain ports in me. And after a few days, they came in and closed up one drain port, and then like a day later, they came in and closed the other drain port. And of course, you have to be all closed up before you can go home. And it began moving quite fast. My body took to my new liver like almost immediately, and which is like way cool. I mean, and part of the ammonia going to the brain thing, where it caused the fog and all of that stuff, happens because your body stools are not relieving themselves fully, or as fully as you need, because that's what helps carry the ammonia out of your body, and that's why it then goes to your brain, because it's not got a place to get rid of.
And you're back to gardening and driving and doing all the things you love, and you took some trips? Yes.
We've been to Sedona, we've been Eureka Springs, we went dancing on New Year's Eve. We have pretty much resumed our old life. I mean, everything about it. I have a garden in my backyard, attending church on a regular basis, whereas before I had to just sit in my chair and watch it on TV, which was great that they had it on TV, because, but, and I'm very supportive. I mean, the people were praying for me like crazy, which is awesome.
I want to get to some questions from our viewers this morning. Jeremy has a question. Were the markers that something was wrong the kind of things that would show up in routine blood work at the doctor's office, or would you need to be tested for something liver specific to see that something was abnormal?
That's a great question. So there are what are called liver function tests, and those are part of the standard lab panel that people get, and so it's a very easy, very routine test, part of most of your annual physicals that you would get.
Tiffany wants to know, what foods should you avoid or implement into your diet for a healthy liver?
So, really we want people to have a healthy, balanced diet is the most important thing. We like the Mediterranean approach, but focuses more higher on protein and less on carbohydrates, and so that's the specific thing, but there's not one great food, one bad food. We like balanced food.
Amy wants to know, how many people with diabetes go on to develop liver problems like MASLD?
This is really scary because the latest data is showing up to 75 to 80% of diabetics are at risk of getting fatty liver disease.
What do you think is the big takeaway from your story?
Well, one, I want to say that I'm very pleased that I had a relationship with God. That gave me faith, hope, strength, and other things. I also had an absolutely off-the-charts wonderful wife for support. Those things are probably the most valuable to me. While I love my health and all of that, those things are what give you the hope to go on. Now, I think a couple of things that I might want to say that I don't think a lot of people realize is, like 1 out of 5 Americans probably have fatty liver. And I mean, that sounds really odd, but 20% of people, and they don't even know it. And the numbers of who is diagnosed with fatty liver are going way, way down. I'm talking children, little kids who have fatty livers. And they either don't know it, or sometimes they're even having to have surgeries done. And I don't think a lot of people realize this. Parents, if you could do anything, help your kids to have a healthy lifestyle. Get them out, let them play, let them exercise, let them do things. And you need to be the ones to control their eating habits, because they're kids. They're going to eat anything sweet that they can get their hands on. And so, that means a lot to me. But the other thing is getting to the doctor every year at least and having your lab work done. Don't put that off. You've got to have that. You can't, I mean, there are other things that could go wrong with your body as well, and that'll bring it up and show it to people. But you need to be diagnosed early and let the doctors help you work through this stuff. The other thing is, I was blessed that my wife was able to work from home, or actually from her computer, because when you go through this, somebody has to drive you everywhere. You can't drive yourself, and you can't drive yourself home afterward. And somebody has to sit there and wait while you're having all these different labs and works and stuff done. And luckily, she was able to bring her computer with her, get to a private spot, and work from her computer wherever she was. And there were hours and hours and hours. I mean, like 1 or 2 days a week, she would have to be out with me going somewhere doing something. This is not some little, you drop in once a month and it's over. This is heavily every week. For hours and hours, and it literally eats up your life. And if you can do anything to help prevent and keep yourself from getting there, or loved ones from getting there, you can't bypass that. You just have to say, this is reality. We need a healthier lifestyle. And I guess what I'd say is, America, we got to get healthy.
I appreciate your passion for life, and I appreciate your passion for health. And you know what makes you a great guest? You're a great storyteller, and I appreciate you sharing yours very much. So thank you so much. And guess what? We're going to come out. I want to come out and see you at your business where you teach jiu-jitsu, right? You're still teaching, right?
It's judo and karate.
Judo.
Yeah.
Okay. We're coming out to see you. So thank you so much for sharing your story. I'm so glad you're doing well. Dr. Taylor, wrap us up. And what's the big takeaway today?
Yeah, absolutely. I think Terry said it best. Is prevention is the best situation with liver disease. So the earlier you can be diagnosed and work towards these things, the best the outcome you can have. I think Terry's great story is because he came in early. We were watching him very closely, getting the routine test, and we were prepared when these things happen. And that was a great story. Unfortunately, most of the time we meet people with liver disease when they're having one of these emergencies that Terry highlights. And it's much better when we already know the patient, have a game plan, and then you plug them into that, and so they have a better outcome.
Thank you both for being here today.
Pleasure.
Appreciate you both. All right, and thank you to all of our viewers for being with us today. We'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update. She lived with seizures for years, only she didn't know they were seizures. I'm Jessica Lovell on the next Morning Medical Update. The long journey to the right diagnosis and best treatment that has this young mom living seizure-free. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.